ਹੈਲੋ ਹਾਂਜੀ ਗਾਇਸ ਵੈਲਕਮ ਕਰਦੇ ਹਾਂ ਤੁਹਾਡਾ ਨਰਸਿੰਗ ਕਰੀਅਰ ਚੈਨਲ ਦੇ ਉੱਤੇ। ਸੋ ਜਿਹੜੇ ਆਪਾਂ ਹੁਣ ਵੀਡੀਓ ਦੇ ਵਿੱਚ ਡਿਸਕਸ ਕਰਨੇ ਆ ਇੰਪੋਰਟੈਂਟ ਕੀ ਐਂਡ ਟਰਮਸ ਨੇ ਸਪੈਸ਼ਲ ਗਾਇਨੀ ਦੇ। ਚਲੋ ਫਰਸਟ ਕੁਐਸਚਨ ਦੇਖ ਲੈਂਦੇ ਆ। ਤੇ ਵੀਡੀਓ ਸਟਾਰਟ ਕਰਨ ਤੋਂ ਪਹਿਲਾਂ ਸਾਰਿਆਂ ਨੂੰ ਰਿਕੁਐਸਟ ਆ ਪਲੀਜ਼ ਚੈਨਲ ਨੂੰ ਸਬਸਕ੍ਰਾਈਬ ਕਰ ਲਿਆ ਕਰੋ। ਤੇ ਐਗਜ਼ਾਮ ਵੀ ਨੇੜੇ ਹੀ ਆਉਣ ਵਾਲਾ 24 ਜੁਲਾਈ ਨੂੰ ਐਗਜ਼ਾਮ ਆ। ਸੋ ਸਾਰੇ ਜਾਣੇ ਨੂੰ ਮੇਰੇ ਵੱਲੋਂ ਬੈਸਟ ਆਫ ਲੱਕ and good wishes. So chalo first question देख लेने हैं. A test commonly used to determine the number, motility and activity of sperm is the dash. So ਕਿਹੜਾ ਟੈਸਟ ਆ ਜਿਹੜਾ ਡੈਟਰਮਾਈਨ ਕਰਨ ਦੇ ਲਈ ਨੰਬਰ, ਮੋਰਟੈਲਿਟੀ ਐਂਡ ਸਪਰਮ ਦੀ ਐਕਟੀਵਿਟੀ ਕਿੰਨੀ ਹੈ ਕੀਤਾ ਜਾਂਦਾ ਮੇਨਲੀ ਪ੍ਰੈਗਨੈਂਸੀ ਦੇ ਲਈ? Huhner's test. So it's known as Huhner's test. Second, one of the most common causes of obstructed labor. So most common causes of obstructed labor is cephalopelvic disproportion. Cephalopelvic disproportion. Third, bladder irritability begins at. So bladder irritability begins at 6 to 12 weeks. Fourth, clear vehicles on the face, scalp and perineum caused by retention of sweat in the sweat glands is also known as Milia. Fifth, the birth hazard associated with breech delivery is known as compression of cord. Sixth, contraction stress test is indicated in a client with a pregnancy of more than 40 weeks. So contraction stress test is indicated pregnancy of more than 40 weeks. Seventh, if the pregnancy the cardiac output increases about, so answer is 5 to 7 liter. Eighth, if the fetal blood vessel the oxygen contact is highest in the ductus venosus. Ninth, ovulation method of planning, family planning is known as calendar method. 10th, from 18 weeks after conception, the fetus is covered with the white creamy substance is called as Vemix. 11th, episiotomy is performed during delivery. This is most commonly done to prevent laceration during birth. To prevent laceration during birth. During the taking hold phase, the nurse should accept the new mothers to call the baby by the name. So call the baby by the name. 13th, cessation of breathing more than dash is known as apnea. More than 20 seconds is known as apnea. 14th, an infant with meconium ileus shows the clinical sign of abdominal distension. Next, 15th, the abortion in which fetus dies and retained with its placenta in the uterus is known as missed abortion. Which abortion? Missed abortion. Then 16th, the fertilized ovum is known as zygote. Fertilized ovum is known as zygote. 17th, in case of meconium staining, the amniotic fluid becomes green color. Which color? Green color. 18th, maturation of cervix begins at 5 to 6 weeks prior to labor. 5 to 6 weeks prior to labor. 19th, the most common preterm complication is respiratory distress. Respiratory distress. 20th, the best intervention to delay delivery of clients with vaginal bleeding in the last trimester is bed rest. 21, a newborn frequently out to be nursed every 2 hours. 22, in the type of 4 placenta previa, the placenta is called centrally over the internal cervical. Centrally over the internal cervical. 23rd, the narrowest diameter is the pelvis trans diameter. Narrowest diameter the pelvis is trans diameter. 24th, cow's milk contain more protein, less calcium and less. So the less carbohydrate is the right answer. 25th, the length of average cord is 50 centimeter. So average cord length कितनी होती है 50 centimeter. 26th, the client 41 weeks gestation comes to the labor suit with bloody show and no contraction. A vaginal exam reveals that the baby's head is at +1 station, and acceptable method of inducing labor at this time is also known as artificial rupture of membrane. Which membrane? Artificial rupture of membrane. 27th, ovulation occurs, blood level of LH is high. When blood level of LHS is high, ovulation occurs. 28th, in a normal neonates, the ductus arteriosus functionally closes by about hyperfibrinogenemia. 29. The normal respiratory rate of an infant within 3 minutes after birth may be as high 60 minutes. 30. Abdominal enlargement is seen at 12 weeks. So 12 weeks abdominal enlargement is seen. So ये ਆਪਾਂ important key and terms कीतियां ने. So ख़त्म करते हैं इत्थे वीडियो. Okay guys, take care.